This is my fourth year in a row participating in Dental Day at the Capitol. It's important for all of our members that the legislators hear from their dentists and what's important to them in their community, taking care of their patients. As small business people in Minnesota, it is vital that we provide dental services to the people, employ people, and work with our legislators to provide dental care for Minnesotans all throughout the state. There are many issues being discussed at Dental Day. The first one is the single administrator. While this probably won't pass this year, planting the seeds for the future will enable us to get rid of the monies that are being channeled by the HMOs and get them to the dentists that are needed to take care of their patients. Another big issue this year is the HPSP program and the relationship that they have with the Board of Dentistry. Currently the Board of Dentistry and the HPSP have a good relationship. We want to continue to have that relationship. The other issues that are coming up is the sunset of the provider tax. We want to continue that goes away for our members down the road. So far I've had two great meetings, one with my own representative, which went really well. I've known her for 3 years, and I just had a really great meeting with a dental student, a second-year student, grabbed me, and she was quite nervous, and I went in with her, and I was with her, meeting with her representative, and it was just kind of reassuring that she talked about the issues that were important to her, student debt, the ability to have a practice when she graduates, and just some of the issues, again, centered on taking care of patients in the Minnesota area. There's over 100 of us here today. I'm really proud that there's over, I think, 40 dental students here. So obviously they are very excited about their careers in the practice of dentistry, and for them to take a half a day out of their school to come over here, it just shows how important it is to them.
Good morning, and thank you. Back in the 70s, when I was a little younger, I met a young dental intern named Dr. Greg Sheehan, who has a practice up here on Rice in Maryland. And he was an intern out in the Hopkins area for then Dr. Malloridge. And we became very good friends. We met at the Hopkins Optimist Club, and we've maintained that friendship and relationship over the past 30-plus years. He is very passionate about politics and healthcare delivery, and he was sharing with me some ideas, and it inspired me, being a new member of the legislature, to think about how we could solve that problem. But one of the things he addressed, and I introduced a bill last week, that will enable all of you as members of the healthcare delivery team to provide influenza immunizations. And I'm excited about that bill because we know that in order to maintain a healthy population in our society, it's important to control the spread of infectious diseases. And for many of the outstate and rural areas of Minnesota that don't have a CVS or a Walgreens or a Minute Clinic, I agreed with Dr. Sheehan that this is an excellent way to make sure that people have greater access and greater choice to getting a flu shot. So I encourage you to support what I've done, and I hope that you'll take that opportunity while people are sitting in your waiting room during the flu season, that they can fill out their little screening card. And I would presume that you'd probably prefer to give the shot after your procedure, but anyway, they would be ready for that. And with 80% of the elderly, as Dr. Sheehan had reported to me, see their dentist once a year, what a great way to help control the spread of influenza. Thank you very much.
Thank you very much for the invitation to speak this morning. It's always a great pleasure to address groups like this. I've seen a trend over the last few years, in at least as long as I've been in the legislature, that there's a growing and strong recognition that the mouth is part of the body. And it seems so silly to have to say that, but we really treated it as though it wasn't. A couple issues I was kind of asked to talk about a little bit. There's this idea floating around of a single administrator for dental care, and I'm really somebody who thinks that our system is far too complicated. The issue with insurance companies have made life difficult, not only for patients but for providers, and our goal is to support patients in Minnesota and support providers, and to the degree necessary or possible, I'd like to remove the middle people from that equation and make things smoother for you. And I know that especially many dentists are in small practices, even solo practices, where the administrative burdens just become a huge part of your day. Another issue that I know you're interested in is the Health Professional Services Program, HPSP. I hope I got the name right. I'm so used to using the acronym now. Some of the issue is that practitioners who were, diverting drugs from patients and stuff like that, stuff that everybody recognizes is absolute, unacceptable public health hazards. Some of those things need to be dealt with a little better. So there are several ideas floating around. I put in a bill, the Board of Nursing has a bill that I'm also carrying, and it's what we're doing this year is it's kind of to get all the ideas on the table, and then when we have the hearing next week, we'll be kind of deciding which elements of that will go in our policy omnibus bill. I think there's a growing recognition in the state that addiction in particular is a huge problem. And we know that HPSP, of course, deals with many more problems than just addiction, so I want to be clear about that, and I think it's functioned pretty well from what I can tell, because we know, along with the growing recognition that the mouth is part of the body, we have a growing recognition that substance abuse is a chronic illness, not a moral failing. And so we need really to balance that understanding with the fact that health practitioners are dealing with vulnerable people and that we have to keep patients as safe as we can. But the HPSP program, I think, has been very good, allowing people to submit to monitoring, get various kinds of conditions imposed, and hopefully be able to practice safely under that supervision while they're in recovery. And we certainly don't, the legislature shouldn't be micromanaging that stuff, far from it. We don't want to tell people, we're not experts, we're lay people. So our job is to just sort of help the organizations in place and the rules in place that help them make the decisions and do their job. But one of the big problems has been, when we did this hearing, we heard that there were some gaps that people could get, they could fail out of the HPSP program. Maybe they weren't doing their UAs, maybe they weren't showing up for their meetings, whatever. And then there would be a long gap before the board could review their case and make a decision. And in that gap, people could be practicing and doing real harm to patients. So one of the things we want to do is to fill that gap.
And I really do want to emphasize how important it is that you are here and willing to go and talk to your legislators and tell them what's going on in your lives and in your practices. We're part-time legislators, right? We come to the Capitol and we don't have that broad of an expertise, and so your willingness to come here and share your expertise helps us make our decisions much more effectively and hopefully better for the people of Minnesota. I know that you have some proposals that you're working on this year around around a single administrator and around some other things to make sure that the proposals work, that your practices can interact with the state government more effectively. So that I think fits in very well with that direction that we're headed this year. So that I hope that you're continue to work on those items. So the big things that we have on the agenda this year, we are going to be working on raising the minimum wage in the state. We think that makes good economic sense, but also is the right thing to do. We shouldn't have people working 40 hours a week and living in poverty, and that's kind of the fundamental value that we're operating on there. We are going to provide some tax relief. We're passing today, actually, on the House floor, some middle-class tax relief in the form of what we call tax conformity, basically conforming Minnesota's tax code so that people in Minnesota can take advantage of some of the tax breaks that the federal government passed last time. Eliminating the marriage penalty is one of those, but things like adoption credits, college tuition credits, those types of things, as well as repealing a couple of business-to-business taxes that were passed last year. So that will be happening in the House today, and we're excited to be moving quickly on that. And then we have the other big piece of work we have is the bonding bill, and probably in all of your communities across the state there'll be some impact of that bill in terms of investing in infrastructure, roads and bridges, colleges and universities, those types of things, using our public dollars to do, our borrowing some public dollars to invest in public infrastructure. So that is really kind of the scope of what is happening. The Healthcare Committee has actually been very busy this year, the Policy Committee looking at any number of things. And I'm assuming that you've been monitoring that, following that pretty closely. But I think that at the end of the day, it is going to be a limited agenda. And so you want to kind of make sure that you explain how important the issues are to you if you want things to move this year. And we have about 2 weeks left, so it's very timely that you're here today.